growth is a pillar that we have to maintain, nourish, take care of, because if you do what we do, if you're open access, anybody who wants to come in comes in that moment they need to come in, okay? Not, hey, we'll bring you in 3 Tuesdays from now when the moon is full, right? No, you're coming in right now. And we don't want to overburden one office or let's say one physician or nurse practitioner, because if we did that, we would just grow to that one spot and it would blow it up, and pretty soon you wouldn't have a model. So our model of open access and continual growth, provider wellness, great operations, mandates that we grow, okay? It could be growing an office 2 miles away. It could be growing a urgent care in a hub between 4 or 5 offices and 1 mile away, okay? It could be putting an office somewhere else 10 miles away. But what we do is we monitor. It sounds, oh, that's common sense, but it really isn't. In the healthcare ecosystem that exists today, it's not. We develop models depending on which system you're in healthcare, whether it's a healthcare system with a traditional healthcare system or with venture capital, private equity, or with a retail environment. You look at that as sort of its own ecosystem in one spot. So what we've done at One Health is we said, no, every clinic is interconnected. So if we have a clinic here in Cornelius and there's a clinic in Greensboro, if you walk into that clinic, it's like you're walking into your home clinic. And they're all interconnected. They're all interconnected with growth, they're all interconnected with leadership and talent that we were describing earlier. So growth becomes an inevitable thing. It's not just for growth's sake, it's to grow, and you grow really in a smart way. And it's been one of the things that we've traditionally worked with our physicians and our partners over the years, because it's a hard thing. Why do we grow? Why do we want to grow? Well, if it was just about us, we probably wouldn't grow. We'd grow to a certain amount, then we would see no more patients. And we do just fine. And there's most of this other ecosystem I'm talking about, that's how they function. But in ours, it's different because we want to make a change. We want to do something different. We've got to be prepared to find a new space, a new building, to adapt our hours. In this clinic that we're sitting in, we have primary care. We have multiple primary care doctors in here, and we're almost full with the primary care. But then we have an embedded urgent care that weaves itself in between, I think, 10 and 8 during the weekdays and on the weekends, both Saturday and Sunday. So it's a place where people can always come to get care. That's not a traditional situation. So we're always looking at the unique ways we can grow our practice to maintain the other pillars. Because once we stop growing, you almost have to shut down the whole model. And that's, we often get from the healthcare ecosystem leaders all across the span, why are you growing there? Why, you're only 45 or 50% full. Well, by the time we're 50% full, we're already behind the growth because we're going to fill that up very quickly. And we don't want to get to where a patient feels overwhelmed in a clinic or rush through a clinic.